So now we're going to move on to Dr. Robinson. So Dr. Robinson has been a psychologist in Alberta for over 30 years and has worked here at the Tom Baker Cancer Centre for over 25 of those years. He's an adjunct associate professor of oncology and clinical psychology at the University of Calgary. And here at the Tom Baker Cancer Centre, he's a member of the genitourinary and gynecological oncology care teams. He specializes in counseling people living with cancer and their family members. One of John's special interests is the sexual concerns of people living with cancer and their partners. He is also an executive member of the National Cancer Institute of Canada's Clinical Trials Group in the Genitourinary and Quality of Life Committees. He is past director of also has an active research program, and he supervises both residents and students. Please join me in welcoming Dr. Robinson.
Thanks, Joan, and thanks for inviting me to participate in this forum tonight. And I want to join the rest in commending you all on coming out on this kind of cold and wintry night. I'm sure there was temptations just to stay at home tonight. I don't know whether people were surprised to hear that there was a psychologist who was participating in the talk tonight. Lots of times we think about, the treatment of cancer as surgery and chemotherapy, but sometimes we do forget about the psychological aspects of treatment of cancer. I guess the message that I bring to you tonight is it's not breaking research like Dr. Hang brought to you. Probably what I will do tonight, if I do anything at all, is just to remind you of some things that you already know, perhaps confirm some things that are already on your mind. That, essentially, the treatment of kidney cancer, like any other cancer, involves not only the healing of the body, but the healing of the mind and of the soul. That there's the cancer, and it's real, and it needs treatment, but the feelings that we have, we can't look at them under the microscope, we can't touch them in the same way that we can a tumor, but I think you would all agree that the feelings that we have are just as real, and I hope that you'll agree with me that they are just as deserving of attention as the cancer itself. And you might say, well, why is this important? Well, some of the research here that we've done in Calgary is to look at the levels of distress that cancer patients have. And we surveyed patients who were seen here at the Tom Baker Cancer Centre, and these were patients who were newly diagnosed, patients who were on treatment, patients who were well and were coming for their follow-up. And we measured the level of distress, and we found that about 40% of these patients that we surveyed had what we would call a significant level of distress. And you might say, well, what does he mean by a significant level of distress? Well, this is a level of distress that if we had it in most any other circumstance, most people would agree that this is a level of distress that requires some attention. But it sometimes seems that, when we're talking about cancer, that there's kind of a nihilistic approach that, well, of course you have cancer, of course you're distressed. And I see that, within cancer patients, I see that within our staff sometime. And I guess that troubles me, not because it's a false statement, because, as you see, lots of people do have fairly high levels of distress, but the idea that people just have to put up with the distress that they're under, that somehow they just should bear up underneath it. And the point that I'm trying to make is that in most other situations we would say, no, people are under distress and they need some help. And I guess the message that I want to bring to you tonight is that there is help. There are good programs available where we've done research that we know that if people participate in them, that they're going to have a better quality of life. And the other thing that we know through our research is that it's not just the person with the diagnosis themselves who has these high levels of distress, but the family members, the loved ones. Their level of distress in many cases is just as high, And in many cases, it's higher than the person who has the diagnosis themselves. And what we typically find with the family members, though, is that there's kind of a sense of, well, I'm not the one with cancer, and people who are the family members will sometimes say, well, I'm not as deserving of care or support or treatment because I'm not the one with cancer. And our position here at the Cancer Center is that we see the unit of care as the family of all people who are affected by cancer, and essentially that no one is more deserving of attention or recognition of what they're going through than anyone else. Over the 25 years or so that I've been here, there have been some significant improvements in terms of the recognition of the importance of the emotional care of cancer patients and their families. And through the work that actually came out of the Tom Baker Cancer Center, emotional distress is now recognized worldwide as what we call the sixth vital sign. So what that means is that, when cancer patients are seen, not only should they be checked to find out whether they're running a temperature or have high blood pressure, or that they also should be checked to see, well, what is their level of distress? That it's recognized that that's a vital sign, that's something to check on a regular basis too. So, what's contributed to some of these changes? Well, I think some of it is public figures kind of talking about what their experience is in dealing with tough situations. And I appreciate Bob coming tonight and sharing so directly and openly about what his experience has been like. And one person that caught my attention was General Schwarzkopf. And some of you may know that he's had prostate cancer, been treated, and he's talked pretty openly about it. But what caught my attention was when he came back from Desert Storm, commanding the Allied troops, and was interviewed by Barbara Walters. Did anybody actually see that interview who's here tonight? Yeah? Do you remember it? Yeah. Parts of it. Well, if you remember when he was addressing his troops over in the Middle East, he had tears streaming down his face and talking about how being there and commanding the troops was affecting him from an emotional point of view. And Barbara Walters, as you see here, she always goes for the jugular, so to speak, and she said, weren't you afraid to cry? Weren't you afraid that people would think that you were losing it, that you weren't fit for command? Here we were looking to you to kind of stand up against Saddam Hussein, and here you are having tears running down your face. What really struck me was him looking her kind of straight in the eye like he is here in this picture, and saying that he wouldn't trust a person who wasn't able to cry. And I thought, well, that's really quite something for somebody, of his stature and in his position to say. And he went on to say that he wanted people to know that he was a man who was comfortable with his feelings and expressing his feelings, that it's, in his estimation, that it's the people who are kind of divorced from their feelings. These are the people who are really capable of doing most anything, who we might call kind of cold-hearted people. And he wanted people to know that as a responsible person who was making life and death decisions, that he was comfortable with his feelings, and he was using his feelings to inform him about what was right and what was wrong. And another person who caught my attention, I actually had a chance to see Ernie Smith talk to a group of elementary school-aged children. If you don't remember, he was the last surviving Canadian who fought in World War I, and he became quite an advocate speaking out against war, and would go and talk to school-aged children. And he would talk about, some of the atrocities, fighting in the trenches, and some of the things that he did to, earn the medals that he had and to be recognized for his acts of bravery. And I can remember there was one little boy who just was in awe, and he stood up. He didn't do the good thing about putting up his hand and asking a question, but he just stood up and he said, "Boy, Mr. Smith, I bet you're not afraid of anything." His response, again, I thought was quite remarkable. He said, bravery and courage are shown when you do things when you're frightened. And he talked about, in his situation, that if you didn't have fear, there was something wrong with you. And so, okay, what does this have to do with living with cancer? Well, a couple of things. And one time I thought, because I've talked about these experiences in my own life a couple of times, I kind of wonder, well, why am I talking about war heroes, And I kind of figured it out. One of the reasons, I think, is because I hear very often war analogies being used in coping with cancer. We talk about winning the war against cancer. We talk about, fighting the battle. And, we can get into a discussion about whether that's a helpful way of thinking about coping with cancer. Just as a side note, some of you may remember that people took issue with the headlines when Jack Layton died, that he lost the war with cancer, and people thought, well, that's not a fair statement. If anything, he was exemplary in terms of living his life well despite having cancer, and to think of him as a loser in any way was really not a very kind thing to say. But that aside, I think that it's helpful for us sometimes to look at some of these public figures and the example that they do give us about how do we deal with tough emotions, how do we deal with things that frightened us. And in terms of how this relates, I guess, to living well with kidney cancer, I think we have to start with the position, you talked about above, that, when you hear those words cancer, it's pretty hard not to have an emotional reaction. And there's lots of emotions that come along, but one of them typically is fear. And so the question, I think, really is not whether we have the fears, as Smokey Smith said, but what do we do? How do we respond to those feelings? The two most common ways that I see that people respond is through reassurance. And hopefully you're getting some reassuring messages tonight. And these are some typical things that I hear people say that are reassuring messages. I've had, or she's had, good surgery, having, treatment in a world-class cancer center, and hopefully you're getting that message here tonight, I'm going to be okay. Or we hear, encouragement to that, essentially what I call distraction, to keep busy, get back to work, get on with your life. And I think, for the most part, those strategies do work pretty well most of the time. But I don't think it's reasonable to expect of ourselves or to expect of our loved ones that those two strategies are going to work all the time. What lots of people will say is that they can be really positive, that they can keep busy during the day, but so when they wake up at 2 o'clock in the morning, those thoughts creep into your mind of, even though you've had really good surgery and you're seeing world-class physicians, there's still that doubt that comes into your mind. And at 2 o'clock in the morning, it's kind of hard to distract yourself. But people will kind of beat themselves up and think, well, I've got to be positive. I've got to think positive. And they think that there's something wrong with them, or that they're, letting themselves down in some way if they can't be positive all the time. And as I say, I think that's an unreasonable expectation to have of ourselves or to have of our loved ones. That what I typically find is that at some point in time, there's some recognition that we need to face our fears in some kind of a head-on and direct fashion. That there's a process that's kind of tried and true, and hopefully, as we go through this will ring true to you as we talk about it, that the first step really is to say, okay, let's look at what these fears are. Try to break them down. I've listed some of the things that commonly come along, that when we say that, that we're frightened of the cancer, is the loss of independence and control, the fear of the cancer spreading or recurring, Did I make the right treatment choice? Living with the after effects or the side effects, living with pain and suffering, the fear of death, the effects on our loved ones. That even though in some ways it's difficult to break things down, that when we break things down, they do become a little bit easier to deal with. It allows us then to kind of take on things kind of one step at a time. But what people are often concerned about is that being kind of flooded with the emotions that come along with dealing with these things. And I think it is important to keep control of what the emotions are. And that's a little bit different than denying that there are emotions there. Part of it is thinking about, well, how do we develop emotional strength? And I'd suggest to you that we develop emotional strength in much the same way that we develop our physical strength. That if we want to build up our muscles, right, we start with smaller weights and we lift them until we've developed some strength, and then we take on, heavier and heavier weights. So of taking some of these fears, some of the ones that are perhaps a little bit easier to manage, dealing with them, developing the confidence that, okay, we can talk about these things, we can deal with them, we can face these things, and then we'll move on to the ones that are a little bit more challenging. It's always easier, I think, if we have support than trying to deal with things in our own. Meetings like this, Kidney Cancer Canada talked about the support from the nurses and the physicians, and as I'm saying, there's professional support that's available as well. And seeking guidance from people who are further along in their journey, from family and friends, seeking professional support to get guidance as to, okay, how do we deal with these things? So, I guess in a way of summing it up, my daughter, when she's heard me talk about some of these things, she said, well, Dad, tell them about Harry Potter. Who hasn't heard of Harry Potter here? Right? And if you know the story, right, the sinister fellow is referred to as the man who must not be named, or he who must not be named. You're referred to C, right? Nobody will say the word cancer to you, and a lot of that happens, right, within the cancer world. It's so awful that we can't even speak the word cancer, right? But if you know the story, and the moral of the story that J.K. Rowling was developing is that, again, Harry Potter was the brave one who was probably the one who had the most to fear, who said, I want to find out about who this fellow is, encourage people to call him by his name, right? If you know the story, it's Lord Voldemort, to find out really who he is and what he's up to, and found out that his name, right, was Tom Riddle. And it wasn't that Harry found out that there wasn't anything to be afraid of, but his position was, as Loring said to start the evening, the more we know and the more it is that we know about what we're facing, in many ways, it's easier to deal with. And that Harry said, that, we have to name what it is, and when we name what it is, it becomes a lot easier to deal with. So, there is this department of Psychosocial Resources here at the Cancer Center, and apologize to the folks in Edmonton there. I didn't realize you were going to be joining us, or I would have included some of the services that are available in Edmonton. But in Edmonton, the same as here, these services are available at no extra charge. They say the emotional or the psychological care is seen as a part of the care that's offered here, just the same as surgery or chemotherapy. One-on-one counseling is available. There's help to deal with the financial aspects, the burdens that sometimes come along with cancer. There's stress management workshops. We have meditation classes, exercise classes. Talked about the importance of exercise and dealing with the fatigue. There's programs for the children. Children of cancer patients are also affected, and sometimes what we try to do is to protect them from what's going on. But again, what we find is that children do cope a lot better if they're given information and if they're actually included in what's going on. We published this book called The Emotional Facts of Life with Cancer as a way of trying to give people information about, how can professional counseling be helpful to them. So there's a whole book here that Loring's brought some copies that you can take. And if you're wondering, well, what's your level of stress or distress, there's a questionnaire in here that you can fill out just to kind of, in some ways, take your own vital sign and find out, well, okay, how are you making out in this regard? And the other brochure here will give you information on all of those programs that I went through and some of the others that I haven't mentioned. So I thank you for your attention, and I guess we're ready for questions. Is that next?
Thank you very much, Dr. Robinson.